Judith Smith, Director of Health Services, City of Port Arthur Health Department. Tonight we're here at Ecclesia Church. We have decided to partner with the Jefferson County District Attorney's Office to do a community meeting on One Pill Kills. And so we have just sent out a lot of information to the public because we really want our community to be informed so that we can make healthy decisions and so that we can help save lives in our community. I'm really happy to work with Mr. Britt Featherston. He's here with us tonight, and he has pretty much orchestrated this whole thing. We heard about this happening in Beaumont, and we really wanted the same thing to occur for our people in Port Arthur, our community in Port Arthur and the surrounding areas.
My name is Britt Featherston. I'm with the District Attorney's Office here in Jefferson County, and I want to tell LD thank you for covering this. We're out here in Port Arthur at Ecclesia Church to get the message out that we've been trying to spread in our community about the dangers of the drug fentanyl. As the sign says, we're in a race against time, and that race course is a razor's edge, that all it takes is that one mistake, and that one pill, maybe just one, is all it takes to kill you. And fentanyl is a dangerous chemical that's being shipped into this country by the drug cartels, and it's been mixed into all kinds of drugs, including vaping. And that chemical is all it takes is just a little bit too much, and we're seeing people get killed by it. And so we're trying to get that awareness out there to everyone, to anyone out there who might be thinking about buying a drug or a pill off the streets. Just remember that this stuff could contain fentanyl and it can kill you.
Such a great cause.
All right, I'm next.
You're next. Let them sit here.
All right.
Or you want to hold their hand?
You must record saying you still you love
All right. Okay.
Taking a deep breath. Load out.
All right. Wow, you did a good job.
Just thank him for allowing us to come into the sanctuary and to have this community meeting that's so important. It was, the relationship between the health department and Ecclesia have been ongoing for many, many years, and we've done quite a bit of programs here, and we just really cannot thank you enough. Your commitment to wanting to see our community be safe and being healthy, especially with everything that's going on, and especially now with all of the information in the news about fentanyl. I do want to acknowledge our health authority who is here, Dr. Oscar Enrique. Employees that are here, the health department staff, where are you? Just wave your hands. I'm grateful that y'all are here. Our chief of police is here, Chief Durso, Chief Benson, our fire chief is here. I see Councilwoman Beckham is here.
Thank you, Judith, and I want to thank her especially because as soon as we mentioned that we were wanting to get this further out of Beaumont and get down here to Port Arthur, she jumped on it and said, I'll find this location. Pastor Torres, thank you so much. We walked in here and your great staff immediately met us and showed us what a great facility you have. And really, this is an awesome facility, and so glad so many people came out tonight. So thank you very much. Chief Durso and I worked together at the Port Arthur Police Department back many, many years. And so he went to the feds and I went to the feds. And then we ended up together, working together in Beaumont for many years. And it's funny, both he and I have lived all over the world, and yet somehow I always end up back in Jefferson County. I'm always coming back to Port Arthur, and this is where I was born and raised. still love Port Arthur. Graduated Thomas Jefferson, like some of the others in the room, and you know, it's great to be back here, especially on such an important topic. Before I forget, we have also federal DEA representatives, Drug Enforcement Administration representatives here also. I want to thank them for coming over. And also the Port Arthur officers are here. Thank y'all for being here, guys, and the work you do every day. You know, we appreciate everything you do, every step you take out there protecting this area. Probably worked on hundreds of cocaine cases, methamphetamine cases, heroin cases with Tim Durso of all, you know, your chief. And of all those cases we worked on all those years, you might have an overdose death, 1, 2, maybe. It was pretty rare, right? We don't see a lot of overdose deaths, surprisingly, with the methamphetamine, with the heroin, and with the cocaine. But then all of a sudden, about 2 years ago, Brian, about 2 years ago, we saw this new drug creeping in. And then we thought, oh, well, it's coming in off the East Coast. It's not going to affect us. It's not going to bother us. And next thing you know, it's creeping closer and closer. And it's this drug called fentanyl and carfentanil. And I say a drug loosely because it's not a drug, right? It's a chemical. This chemical is being shipped in mostly from China, shipped into the drug cartels out of Mexico, and then they ship it mostly over the border. They're not making the pills. Most of the time they're shipping the chemical over the border, where the pill presses mixed in with cocaine, mixed in with methamphetamine, mixed in with heroin, or even seeing it mixed in with vaping. We're running on that race is a razor's edge, because if you fall off and you take that one wrong pill, it kills you. That's the difference. We're seeing this drug, this chemical is killing people, and then we're dead. And that's what we're seeing in this community. So I'm gonna stop right there and show you this wall. Let's see here.
I've been in church since all my kids since they were little, and he could tell them, quote them Bible verses like no other. And we'd go to church every Sunday and Wednesday, and he was loved by everybody. He was everybody's favorite.
Who is a victim of fentanyl? Everybody. It sees no race, it sees no age, no class. Only thing it sees is that whoever decides to pick up a pill that they bought off the street, there's a very good chance, 7 out of 10 chance, that pill's gonna have fentanyl in it. The cases we're seeing today have multiple fatalities in them because of this fentanyl. These are pictures of people that have died. If you get a chance, go to texaspictures.com. There's a man in Houston he's a movie producer. He's produced for National Geographic and for other Dateline. And he became so moved by this problem that he decided to start interviewing the families of the victims of fentanyl. And so far, I think he has over 65 interviews of Texas men, women, children that have died from fentanyl. And their stories are, every single one of them are like that. They just break your heart. They just break your heart. The University of Texas. He grew up eating right, lifting weights. He barely drank. Only thing he would do is his whole goal was to be a professional football player. And he did everything right. And that's why those of us in law enforcement, we've been around people who take drugs. We've been around people that take a lot of drugs. But this is different. This is the person that works, the dental hygienist that I know of that has died from this, the doctor from the Woodlands who died from this. This is high school kids. As we sit here today, in the last 2 months in the Cleveland Independent School District High School, they've had 11 overdoses in their high school in the last 2 months. Narcan 7 times. So it really knows, no, it's not a back alley. It's not what the movies portray, a drug user that uses drugs in a back alley with a syringe in his arm. That's not what we're talking about. But they started putting Narcan in all their AED boxes.
all their supervisors of the dorms started carrying Narcan in their pockets. There's something wrong, right? That's called a clue that you've got an epidemic, you've got a problem. And I'm going to hit you with a stat later at the very end of this that's going to blow you away. But the point of these, number one, these pills look innocent, right? Look at the M30. That's supposed to be an OxyContin. You can't tell the difference. You can't tell the difference. At these 3 vials, if you look at the amount of fentanyl it takes to be deadly. So the middle one, the carfentanil, is basically a supercharged version of fentanyl. It's even less. We're not seeing a whole lot of that. Every once in a while we do see carfentanil, and then if you see heroin to your left. So that's the lethal dosage of fentanyl right there. So probably what you're thinking is, well, why would the guy selling drugs, why would they want to kill somebody? Why would they want to cause this, because why do you kill the person you're selling things to, right? Well, they don't intend to. This is just a cost of business for them. They don't intend to kill anyone. But what they're doing is, in that garage in South Texas, they're mixing fentanyl into a garbage can along with other fillers. Might have some oxy in it. It might have a Percocet in there. It might have cocaine. It might have methamphetamine. And they're sitting there with a big, basically a bread mixer of mixing these chemicals. And who's made chocolate chip cookies? So if you make chocolate chip cookies and you pull out the dough and you set it on the tray, and I'm always the one that ends up getting the chocolate chip cookie without any chocolate chips in it, right? Everybody's made those chocolate chip cookies. And then you look over and my daughter's got the chocolate chip cookie that has all the chocolate chips in it. And the problem is that that's what happens when they're mixing the drugs, putting fentanyl into it, is they'll put too much fentanyl into one side or too much into another, and then when they mix it, it's not equal. This isn't happening in a lab where it's being sterile tested and making sure it comes out even. And I'm telling Brian, don't do it. But I go to Cozumel a lot, and I often will buy antibiotics in Cozumel. And now I don't, because they've started seeing where and the whole purpose is that if they can add fentanyl to anything and increase that addictive property, that you will like taking that pill, and you will want to buy another one of those pills, and you will want to buy more of those pills, and you're going to tell your friend, man, this Percocet didn't just make me feel good, it really made me feel good. 1,000 times more. So if I'm a dealer, if I'm a cartel member, I want to get in the fentanyl business. A lot less chance of getting caught. The addiction to it that's being added because it's fentanyl, that means I got more customers coming in. They're coming in left and right. A lot more profit for the cartel. And if you add up all the seizures that DEA and all the law enforcement agencies have come about now, you could kill everyone in the United States 10 times over. That's how much fentanyl is pouring into the United States. I just saw this article the other day and thought I'd throw the title up there. The highest, the one thing that's killing more 18 to 45-year-olds in this country than anything else is fentanyl. If you add up, now listen to this statistic, if you add up all the gun-related deaths, right, because that's all the news covers, right? That's all we ever hear about on the news, right? Gun-related deaths. If you add up all the gun-related deaths and you add that to the alcohol car wreck-related deaths, fentanyl-related deaths still outnumber those deaths. All right, I am going to stop for a minute. You've heard enough of me, and I'm going to ask Ms. Cynthia to come up.
A lot of times when people get on these medications, you may be sitting there thinking, well, that wouldn't be me. No, I wouldn't get on that medicine. Have you ever drove past Starbucks and you didn't want a coffee, but you went and got a coffee? Because you're a coffee drinker? Sometimes people just take one pill, they had a backache, and now all of a sudden they find themselves, well, it did relax me, like Mr. Brett said. Oh, it helped me sleep at night. And that's how an addiction starts. Most people don't look to get addicted. I always talk about when people go to, career day at school, or a parent-teacher conference, I don't know any child who showed up to career day to say they wanted to have an addiction. Nobody showed up saying, I want to be addicted to drugs. Nobody went to parent-teacher conference and they said, when your child grows up, they want to be addicted to drugs. It's something that triggered them to get on those drugs. Sometimes it's untreated anxiety. I just need to shut my brain down. You call a friend, don't you have something I can take? Untreated depression. And we're getting into a season right now, we have to think about even people that have been on these drugs, they can relapse during this time. Thinking of how the holidays used to be when mom was here, when dad was here. I need something to shut my brain off. Or the finances of the holidays. So what are we going to do with these people once they come to us as medical providers or in the community? This medication right here, Narcan, I'm going to say Narcan, there's, naloxone you can say too, but Narcan, easy. This should be with every AED and every first aid kit. Every AED, every first aid kit. Somebody who looks like they're presenting in cardiac arrest may not be true cardiac arrest. You got an 18-year-old, a 25-year-old looking like they're in cardiac arrest. It may not be, it may be that they took something because they needed to take that exam to shut their brain down. How quickly can somebody die of an overdose? 4 minutes, about 4 minutes without oxygen to the brain. That's it. What's your turnaround for EMS to get here? About a 7-minute window. Look what you can do very quickly. I'm going to pass this around. This is the actual medication for you to look at. And it has a little flyer. We're going to go through the PowerPoint real quick. You see that mom crying? If that wasn't impactful, what if Narcan would have been at that party? Just that quickly having this medicine on board. Look, we can use it in anybody. Infants, why would an infant be on this? They got it to mom's medicine, daddy's medicine. Grandma's medicine, let's go back to those pills. Grandma had hip surgery. She's keeping kids after school. If you're a cash patient, what are you paying? You're paying an office visit and you're paying for meds. So a lot of times to be cost effective, they will go, and it's not that they want to give this to their kids. They're not trying to get their kids fentanyl. They're not doing that. They're going to Mexico getting these medications in good faith, and now you have an 8-year-old or a 10-year-old addicted. You really don't need a lot, right? And if your hand's not working, put it on your hip or something or your leg and push it on in. You don't need a lot to save somebody's life.